We are live now, man. You can start the session.
Okay. Shilpi, you can just get the. So, good evening, friends, and welcome to this Pan India Intercollegiate Quiz Brain Teasers, which is being in association with Ophthalmological Society of Nagpur, and it presents the Big Q.
आठ समंदर अपना अंबर
साला कुछ
खोज
जीतना
ले
ही
अब
नहीं
तू अपने दम पर
Well,
फूक
you are not.
मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल पर
Okay. So good evening once more, and my pranam to all the mentors. Brain Teaser Teams welcomes you all to this fourth episode of this fourth season of Big Q. Well, friends who have joined logged in recently for this season, Brain Teaser is an online platform which was hosting quiz for all ophthalmologists of our country since last 6 seasons, or I should say years. 3 years back, it was for the first time in our country we initiated an exclusive quiz for postgraduates with the aim of getting all the postgraduates across the country on a single platform. There are approximately 320 institutions offering post-graduation in ophthalmology, be it MS or DNB. The first season was done in association with Bombay Ophthalmological Society, and after that, we have been doing it in association second and third season. And even this fourth season, we are doing it in association with Ophthalmological Society of Nagpur. Brain Teaser team is indebted to the OSN team, especially my special thanks to Dr. Krishna Bhejwani, who is currently the president of Ophthalmological Society of Nagpur, for agreeing and associating with Big Q. Well, this fourth season, as we have already been telling, it has 6 preliminary rounds, 4 quarterfinals, 2 semifinals, and 1 finals. And today is the fourth episode, fourth preliminary round. And as you are aware, these episodes would be aired on alternate Wednesday exactly at 7:30 p.m. We are extremely thankful to quiz masters who have toiled hard to really dig into the literature and find some wonderful questions for you, which not only helps you in learning, but it is also a matter of fun. Today's episode, we have some new quiz masters along with few of them who have been associated with us for last few seasons. Let me welcome Dr. Nilotparna Devri, who is currently a senior consultant in the Department of Pediatric Ophthalmology and Strabismus at Sri Sankar Deva Netralaya, Guwahati. Then the second quiz master is a dear friend of mine, Dr. Praful Kumar Maharana, who is an additional professor and at RP Center, All India Institute of Medical Sciences, New Delhi. And of course, our own veteran quiz master, if I can say, Dr. Natasha Radhakrishnan, who has been associated with Brain Teaser since last few seasons. She is currently a senior retina consultant and head of UVA and pediatric retina at Chaitanya Group of Hospitals, Kerala. Thank you, all the three quiz masters, for sparing their time and really taking efforts to create such a wonderful experience for our postgraduates. Well, money maketh the mayor go. It's an old saying. Such a mega project is not possible without a strong financial support from industry. We are sincerely thankful to Mr. Suryanarayanan, Mr. Naresh Rautela, and Mr. Kautu, and the entire team of His Highness for partnering with us for this particular season. I would fail in my duties if I don't acknowledge the field force of His Highness who made if so much of efforts to move from one postgraduate to other, from college to college across the country to get the students enrolled for this particular season. Smooth and flawless execution of Brain Teaser platform has been a signature of Brain Teasers, and we owe all this to numeratic team, which is headed by Mr. Sai and his team. So without much ado, can I request my co-quiz master, co-host, Dr. Shilpi Narnavare, to familiarize the postgraduates with the rules of the game. Over to you, Shilpi.
Thank you, sir. So, good evening, friends. Welcome back to the fourth episode of this season. So, these are our quiz masters for today's episode. So, let's see the rules quickly. So, there are 3 preliminary rounds. So, out of the 6 rounds, today is the fourth episode. And what is the criteria for qualifying for quarterfinals? We will take the best 4 performances of yours out of the 6 performances. So every team has to log in from 2 devices. First is the screen. It is the live quizzing, which will happen on the Zoom platform, while the second screen is the Kahoot to answer the questions. I request all the mentors to log in from a separate screen only on the Zoom platform. So there is a little bit change. In today's episode, there are no one-liners or no unscramble the words. There will be only MCQs, and we will have the 9 sets of MCQs. Each set will have 5 questions, and you will get 10 seconds per question. So these are the prizes for the postgraduates in the finals, while these are the audience prizes per episode. So let's see the sample question for today so that we can check whether the Kahoot platform is working properly or not. So which hockey player is conferred the prestigious Padma Shri Award? And your options are A. Harbinder Singh, B. Bholanath Singh, C. Padma Dilip Tirke, and option D. Vivek Prasad. And your time starts now. Time is up. So just remember, you have to click the answer only after the timer starts. If you click the option before the timer starts, it will not be registered. So the answer for this question is Harbinder Singh. So with this, I introduce our first quiz master, Dr. Nilutparna Deori. She is the consultant at Department of Pediatric Ophthalmology and Strabismus at Sri Shankara Devan Netralaya Guwahati. She heads Ocular Genetics, Myopia Control Clinic, Ocular Trauma, and Binocular Vision, Contact Lens, and Neurovision Services. She is a recipient of prestigious APAO Achievement Award, recipient of International Hero Star Award for AIOS, executive member of YOSI, and she is also the issue editor of Yo Times Pediatric Ophthalmology issue. Sai, madam has joined.
Not yet, doctor.
Okay. So because of some issues in the network, she is unable to join. So I'll carry forward her questions. So this is your MCQ set 1. So your first question is, what sort of anomaly is represented by choroidal coloboma? And your options are option A, agenesis, option B, dysraphism, option C, hyperplasia, and option D, hypoplasia. And your time starts now. So the time is up, and the correct answer is option B. So the second question is, raised IOP in Sturge-Weber syndrome can be actively lowered with all except option A, alpha agonist, option B, beta blocker, option C, pilocarpine, and option D, latanoprost. Your time starts now. Time is up. Here we were asking which drug will not be helpful in lowering the IOP in Sturge-Weber syndrome. So the correct answer is latanoprost. Rest all 3 drugs can help in lowering the IOP. So the third question is, all of the following occurs as a part of oculocardiac reflex except option A, arrhythmia, Option B, trigeminovagal reflex. Option C, hypoxemia. And option D, bradycardia. Your time starts now. Time is up. And the correct answer here is hypoxemia. We never see hypoxia in cases of oculocardiac reflex. So moving on to the fourth question. Cruzen syndrome differs from Eppert syndrome in that the latter is associated with what finding? What finding will you get in Eppert syndrome but not in the Cruzen syndrome? This is the question what we are asking. So the option are option A, significant syndactyly. Option B, proptosis. Option C, inferior scleral show. And option D is hypertelorism. And your time starts now. Time is up. And the correct answer is significant syndactyly. You will get this feature in Eppert syndrome, but not in the Cruzen syndrome. So moving on to the last question of this set. For a child with right severe congenital ptosis and no levator function, what is the most appropriate method of ptosis repair? Option A, blepharoplasty. Option B, frontalis suspension. Option C, bro lift. And option D, levator resection. And your time starts now. So time is up. And the correct answer is frontalis suspension is done when the baby is having the congenital ptosis with no levator function. So with this, we end with the first set of MCQs. And I invite our second quiz master, Dr. Praful Maharana sir. He has done his senior residency in cornea, cataract and refractive from RPC AIMS. Now he is additional professor at RP Center AIMS and secretary of DOS. He has published almost 395 Google Scholar 163 PubMed index papers, which each index of more than 30. He has published more than 50 chapters in national and international books. He has won the Best Surgical Technique Awards for RANSCO, Australia, Young Achievers Award, ISCKRS, Ajit Babu Mazi Award, and awards for best papers in various conferences. He is the principal investigator in 2 ICMR trials, co-PI in 18 trials, including the 2 multicentric international trials. He is the mentor of women scientists for DBT project, editor of 3 Amazon bestsellers in ophthalmology, and editor of DOS Times FOTI. He is among the top 0.08% cornea and 0.19% for keratoconus scientists in the world. So we are happy to have you, sir. Welcome you, sir. Now I hand over the screen to Dr. Prafulla, sir.
Thank you, Silpi. I think you are going to run the questions.
Yes, sir.
Okay, let's move on to our questions. All the best to all the students who are participating. Okay, so first question, there it goes. Which chart is the preferred method for testing visual acuity in a 4-year-old child? Okay, so the options are option A, is it HOTV chart? Option B, is it Lighthouse? Option C, is it the Allen's chart? Option D, is it the tumbling E chart? So the time starts now. Remember, it's a 4-year-old kid, right? Well, the right answer is A, HOTV chart. I hope you could guess it right. 4-year is preschool child. They don't know how to learn. And this orientation, like tumbling E, is little difficult for a 4-year kid because they will lose attention quite easily. So that's why the answer is A. So let's move on to our questions number 2.2. Yes, so penalization, you all know penalization is done by atropine. So penalization treatment is an option treatment in option A, is it for anisometropia? Option B, is it for esotropia? Option C, is it for amblyopia? Option D, is it for anisoconia? Timer, please. Well, the right answer is, of course, amblyopia. I hope you all must have got it correct. Then let's move on to 2.3. Yes, this is the question 2.3. Which of the following statement about refraction in children is true? So option A, is it myopia is more common than hypermetropia? Option B, refractive amblyopia can occur if there is a difference of more than one diopter plus one diopter, okay, hypermetropic. Option C, decreased accommodation is used by children to overcome uncorrected hyperopia. Option D, correction of hypermetropia can reduce exophoria. Okay, so your timer starts now. Read the answers carefully. Okay, the right answer is yes. Hyperopia is more dangerous for amblyopia. I hope you all know that. And option A, little bit confusing. You might have thought myopia is more common than hypermetropia, but it's not the proven fact. Why? Because most of the time, hyperopia plus 1.5, they a lot of kids they do correct with accommodation, and myopic patient presents you. That's why you see a lot of myopic patient in OPD, but no data supports that it's more common than hypermetropia. So the right answer is refractive amblyopia occurs if there is a more than plus one hyperopia asymmetry. So let's move on to our question number 2.4. Okay, so which of the following statement about AC by A ratio, you all know AC by A, right? Accommodative convergence versus accommodation ratio is true. So option A, the eye could not accommodate in the absence of convergence. Option B, the normal range of accommodation or AC by A ratio is between 3.1 to 5.1. Option C, the interpupillary distance needs to be known if the ratio is to be calculated using gradient method. I hope you know there are two methods. Option D, the value obtained using the heterophoria method tends to be lower than that calculated using the gradient method. So the timer starts now. Okay, the right answer is okay. So this is the normal range. It ranges between 3.1 to 5.1. The rest of the options are false, and there is simple change in the language. If you would have read the options carefully, then you could have guessed it. Most of you could have guessed it. And let's move on to our next question, which is question number 2.5. Here it is. When performing a Worth 4 dot test in a 4-year-old child, the child sees two red dots and three green dots. What does this mean? What does this suggest? Options, please. So, option A is it's a fusion response. Option B, the green eye is suppressed. Option C, a diplopia response. This is a diplopia response. Option D, an uninterpretable response. You cannot say what is it exactly. So the timer starts now. So two red and three green dots. Right. Okay, so the right answer is it's a diplopia, so the kid is seeing double, right? That's why if, in spite of having four dots, he is seeing five dots. In all the rest of the three cases, there will be four dots only. The color may vary. So let's move on to, or are we over with this, Silpi?
Yes, sir.
Okay, so this
Have
was the
to
last question.
introduce. Yeah, you
Okay.
have to introduce
Next, I would like to invite Dr. Natasha Radhakrishnan. And I think she is there from the beginning of this quiz series. You must be knowing, all of you must be knowing her. She has keen interest in UVA, ROP, and she is currently looking after all the pediatric retina at Chaitanya Group of Hospitals, Kerala. And she is a DNB gold medalist, She has completed her basic postgraduate and MS from GMC Trivandrum. And I think she's a very enthusiast, and ma'am is very enthusiast and passionate teacher. So welcome, ma'am. Please carry forward the quiz.
Thank you so much, Dr. Prafulla. Good to be here once again. Dr. Shilpi, can we have the questions? So your first question in my set is, which of the following is true about Duane's retraction syndrome type 1? And your options are limited abduction with globe retraction on adduction, limited adduction with globe retraction on abduction, exotropic primary position, and it's caused by a mutation in CHN1 gene. Your time starts now. And your time's up. The right answer is A, limited abduction with globe retraction on adduction. You know that in type 1, that is how it is. Type 2 is B. And in type 1, you will get esotropia, not exotropia. And the mutation is not the CHN1, it is the DURS1. Let's go to question number 2. Which of the following is true regarding infantile esotropia? Options are typically presents after 6 months of age, associated with dissociated vertical deviation or DVD. C, rarely associated with latent nystagmus. And D, does not respond to botulinum toxin injections. Your time starts now. That was a fairly easy one, and the answer is associated with DVD. And typically presents before the age of 1 year, early onset we call it, and it is usually associated with nystagmus and latent nystagmus, and you can use botulinum toxin, especially when you're waiting for surgery to happen. Let's go to question number 3. A child presents with high hyperopia, esotropia, and decreased vision in one eye. What is the most likely cause? A, refractive accommodative esotropia. B, infantile esotropia. C, Brown syndrome. And D, Duane's retraction syndrome. Your time starts now. Time's up, and the answer is refractive accommodative esotropia with the high hyperopia. I think you have the answer very clearly given there. Let's go to question number 4. What is the main visual outcome concern in untreated intermittent exotropia? Your options are amblyopia, B, diplopia, C, loss of stereopsis, and D, anisometropia. Your time starts now. And the answer is loss of stereopsis, because the more time the intermittent exotropia is there is less likely to be stereopsis. Let's go to question number 5, the last question in the set. Regarding prisms, which one of the following statements is most likely to be true? Your options are hypertropia of the right eye could be managed with a base-up prism in front of the left eye. The image formed by a prism is displaced towards the base of the prism. The image formed by a prism is erect and real. When prescribing prisms, the orientation of the prism is described by the position of its apex. Your time starts now. And time's up. And your answer is that you can manage hypertropia of the right eye with a base up prism in the left eye. All the others are false. With that, I'll hand over the questions once again to Dr. Nilotparna Diori.
So let's move on to the next set. That is the set number 4. So the first question in set number 4 is, which test is most likely to determine the etiology of anterior uveitis in a child? Your options are option A, HLA-B27, option B, ANA, option C, Lyme serology, and option D is RF. So your time starts now. RF is rheumatic factor here. So the answer is option B, that is ANA. So ANA helps you in making the diagnosis of anterior uveitis in a child. So let's move on to the second question. What is an early ocular manifestation of SJS, that is Steven-Johnson syndrome? Option A, it's mucopurulent conjunctivitis. Option B is symblepharon. Option C is entropion. And the option D is corneal vascularization. Your time starts now. So time is up. So the answer is mucopurulent conjunctivitis. It is a very early manifestation in case of SJS. So the next question is, in patients with aniridia, what is the most common cause of progressive corneal scarring? Your options are, option A is endothelial decompensation. Option B is LSC deficiency, that is limbal stem cell. Option C is herpes simplex keratitis. And option D is exposure keratopathy. Your time starts now. Time is up. And the correct answer is LSC deficiency. So you see the limbal stem cell deficiency in cases with aniridia. So that is the common cause while you get corneal scarring that is progressive in nature in such patients. Question 4 is, what growth pattern of retinoblastoma is most likely to be mistaken as childhood uveitis, or what we called it as a masquerading syndrome? Option A is diffuse infiltrative. Option B is unilateral multifocal. Option C is unilateral unifocal. And the option D is retinocytoma. Your time starts now. So the correct answer is diffuse infiltrative presence as childhood uveitis in kids. So the last question of this set is 7 tetrad of congenital toxoplasmosis. You get all the features except option A, retinochoroiditis, option B, hydrocephalus, option C, vitritis, and option D, intracranial calcification. Your time starts now. So time is up. And the correct answer is vitritis. You will not get vitritis in a case of congenital toxoplasmosis. So let's see so this is the last question of this set. So now we move on with the next set of questions by Dr. Prafulla Maharana, sir. Dr. Prafull? Sir?
Yes, I'm here.
Okay, sir.
Okay, so the question number 5.1. Unilateral deprivation amblyopia is usually caused by which one of the following? Option A, metabolic disorder. Option B, chromosomal disorder. Option C, local dysgenesis. Option D, craniofacial abnormality. Timer, please. Okay, the right answer is local dysgenesis, because if you notice A, B, D, they all would lead to bilateral abnormality, whether it is cataract or corneal opacity. But any local problem in the eye, that will lead to unilateral cataracts, for example PHPB. So that can lead to your deprivational amblyopia. Okay, so let's move on to question number 5.2. Congenital esotropia frequently has associated with it one or more of the following motor anomalies. Options A, overacting inferior oblique, dissociated horizontal deviation, latent nystagmus. Option B, dissociated vertical deviation, congenital nystagmus, superior oblique fibrosis. Option C, latent nystagmus, overacting superior obliques, DVD. Option D, DVD, overacting inferior obliques, and latent nystagmus. So the timer starts now. Okay, the right answer is option D, DVD with overacting inferior oblique and latent nystagmus. The options are lengthy, so you might be thinking this is difficult, but it's a plain definition of congenital esotropia only. Let's move on to question number 5.3. Okay, so a 16-year-old male presented with history of decrease in vision and night blindness. Younger sister has similar complaints. Now, fundus picture is shown in this photograph. Now, which enzyme is associated with this condition? So, option A, is it ornithine aminotransferase? Option B, arginosuccinate liase. Option C, ornithine carbamyl transferase. Option D, arginines. Timer, please. See the picture, inheritance pattern, and identify the enzyme. Okay, the right answer is ornithine aminotransferase. I hope you know what this carrot dystrophy is. So let's move on to the next question. Question number 5.4. Okay, all are the differentiating features between hypertelorism and telecanthus except. So this is a picture of such example. So option A, interpupillary distance. Option B, intercanthal distance. Option C, interorbital distance. Option D, none of the above. So to read the question properly, all these are differentiating features between these two, except which is not a differentiating feature. Okay, so the options, the timer, please. Okay, so the right answer is none of the above. Whenever there is an option, all of the above, none of the above, that means it's a trivia question. So I hope most of you got it correct. Next question. Okay, so this is question number 5.5. Which of the following is least frequent in incomitance squint or strabismus? Option A, it's acute onset. Option B, it has sensory adaptation. Option C, presence with diplopia. Option D, pass pointing. So out of all this, which is least frequent, okay, or less common? So timer, please. Okay, the correct answer is sensory adaptation. I hope you got it right. Do you have one more question? And that was the last question, Silpi.
So this is the last question in this set.
Okay, thank you, all the participants. This was the last set for me, right?
No, sir, we have one more set.
One more. Okay. So let's move on to our next quiz master.
Yes. Natasha, ma'am?
Hi, yeah, ready. So the set first question is, a patient has a prescription of minus 2.5 diopter sphere, minus 1.5 diopter cylinder at 180 degrees. What is the spherical equivalent? And your choices are A, minus 3.25 diopters, B, minus 2.5 diopters, C, minus 3 diopters, and D, minus 2.75 diopters. And your time starts now. Time's up, and the answer is minus 3.25 diopters. As you know, the spherical equivalent will be the sphere plus half of the cylinder. Next question is, the duochrome test works on which basis? It works on the basis of A, chromatic aberration, B, spherical aberration, C, astigmatic distortion, or D, polarization. Your time starts now. Your time's up. And as you all know, it works on chromatic aberration. If you leave and it is most useful when you're using it for myopic refraction. So you can see that you don't overcorrect a myope by using the duochrome test. And you should always leave the myope on red more clear or red and green letters equally clear. Let's go on to the third question. The Gullstrand schematic eye assumes an axial length of, your options are 20.22 millimeters, B, 22.22 millimeters, C, 24.38 millimeters, and D, 25.5 millimeters. And your time starts now. Time's up, and your answer is 24.38 millimeters. Next question. What is the most common orbital tumor in children? Your options are A, dermoid cyst, B, optic nerve glioma, C, rhabdomyosarcoma, D, Langerhans cell histiocytosis. And your time starts now. I'm sure all of you got this right. It is the dermoid cyst, thankfully, though the others are much more ominous. The last question in this set is a little complicated. Let's go slowly. A dry retinoscopy is performed at 50 centimeters, which means 2 diopter for working distance. The neutral reflex is obtained with the following lenses: horizontal meridian plus 1.5, vertical meridian plus 3.5. What is the patient's final subjective refraction after correcting for the working distance? A, plus 1.5 diopter sphere with a minus 2 cylinder at 90. B, 1 diopter sphere plus with minus 2 cylinder at 90. Plus 3.5 sphere with minus 2 cylinder at 180. Or plus 1.5 sphere with minus 1 cylinder at 180. Your time starts now. The answer is option A, 1.5 diopter sphere with minus 2 cylinder at 90. Actually, a point to remember here is that it should not be called the final subjective refraction, because subjective refraction is once you have placed it for the patient, but you can say the refractive value that you will get after your objective refraction. And with that, we come to the end of this set of questions.
Yes, thank you, ma'am. So with this, we end with the 6 sets of MCQs, and it's time for the commercial break. We are thankful to the His Highness team for sponsoring this quiz for this season. So there is a short break from them. So with this, we move on to the next set, that is the set 7 of today's MCQs. So the first question in this set is blepharophimosis ptosis epicanthus inversus syndrome is usually inherited in what manner? Your options are option A, autosomal recessive, option B, X-linked recessive, option C, autosomal dominant, and option D, X-linked dominant. And your time starts now. Time is up. And the correct answer is autosomal dominant. So the second question is the diopter correction for cycloplegic retinoscopy using 1% atropine is option A, it's 0, option B, 0.5, option C, 1, and option D, 1.5. So what will be the correction you will need if you use 1% atropine for cycloplegic retinoscopy? Your time starts now. Time is up. And the correct answer is 0. So if you use 1% atropine, there is no need of doing any correction if you are doing the retinoscopy under atropinization. So the question 7.3 is in cyclodeviation, deviation is not measured by using option A, prism bar, option B, Maddox wing, option C, double Maddox rod, or option D, synaptophore. And your time starts now. So the correct answer is prism bar. By all other methods, you can measure the deviation. So the next question is, a child presented with early onset large angle esotropia, bilateral limitation of abduction, manifest latent jerk nystagmus on abduction. So I read it again. A child presented with early onset large angle esotropia, bilateral limitation of abduction, and manifest latent jerk nystagmus on abduction. So he may be suffering from which disorder? Essential esotropia, Ciantia syndrome, Lange syndrome, or it's Weber syndrome. Your time starts now. Time is up. And the correct answer is Ciantia syndrome. You get all these features in this syndrome. So moving on to the last question of this set. How many prism diopters of deviation are corrected in general for 1 millimeter resection of lateral rectus muscle? Your options are option A, 3 to 5, option B, 2 to 3 prism diopters, option C, 1 to 2 prism diopters, and option D is 7 to 9 prism diopters. Your time starts now. Time is up. And the correct answer is option B. With 1 millimeter resection of lateral rectus, you get 2 to 3 diopters correction. So now I hand over the screen to Dr. Prafulla sir for his last set of MCQs. Dr. Prafulla sir.
Okay, so let's move on to the set number 8. And the first question is regarding refraction in children. Which of the following is true? I think it's getting repeated.
So, okay, let's move on. So let's move to question.
Okay, so option A. So Silpi has made your life easier, and I hope 100 we get a 100% response to this. So myopia is more common than hypermetropia. Hyperopia more than one diopter can lead to amblyopia. Decreased accommodation is used for uncorrected hyperopia, and correction of hypermetropia can reduce exophoria. So the timer starts now. Okay, well, you all know the answer is B, but let's move on to the next questions. 8.2. Concomitant squint. Okay, so which of the following occurs? Option A, primary deviation is more than secondary deviation. Option B, primary deviation is less than secondary deviation. Option C, primary and secondary deviation both are equal. Option D, none of the above. Okay, so let's have the timer. None of the above is not possible. Okay, don't follow my previous clue. Okay, the right answer is primary deviation and secondary deviation are almost same. That's why the term is concomitant squint or concomitant strabismus. Okay, so let's move on to the questions number 8.3, which is modified Castenbaum surgery is done for. Option A, esotropia. Option B, nystagmus. Option C, superior oblique palsy. Option D, third nerve palsy. The timer starts now. A straightforward question. I hope you all answer it correctly. Okay, so the correct answer is nystagmus. I hope you got it right. Then let's move on to question number 8.4. The fossimeter cannot measure. Okay, I hope you have heard this term. A, the Baek vertex power of the lens. B, the prism. Option C, axis of the cylinder. Option D, refractive index of the lens. Okay, so the timer starts now. Okay, so the right answer is refractive index of the lens. Okay, you cannot measure that with the fossimeter. So let's move on to question number 8.5. Okay, regarding photochromatic lenses, which of the following statement is false or not true? So option A, usually have a more rapid lightening process than darkening process. From black to white is rapid, then white to black. Okay, option B, change their tint depending on the wavelength of the light. Option C, glass lenses incorporate organic photochromic compounds, tend to darken more rapidly if the environmental temperature is low. So, which of the following is true about photochromic glasses or day night glasses, popularly people call it? Okay, so the right answer is usually have a more rapid lightening process than darkening process. Darkening takes a lot of time because there is some photochromatic changes. But once you move out from shadow or dark area to lighted area, it becomes white or transparent immediately. I think this was the last question, right?
Yes, sir.
Okay, so thank you and all the best for question set number 9. And Dr. Natasha can take the set number 9, ma'am.
Yes. Let's run the first question of the last set. So it's a little difficult, so follow me carefully. The following transposition is incorrect. Plano and minus 2 at 180 is equal to minus 2 bar plus 2 at 90. The set of transposition lenses, the set B is plus 2 with minus 0.5 at 60, plus 2.5 plus 0.5 at 150. Plus 7 at minus 2 at 78 and plus 5 plus 2 at 168. Minus 0.25 minus 3 at 50 and minus 3.25 plus 3 at 140. And your time starts now. And the answer is B, plus 2 minus 0.5 at 60. You cannot get plus 2.5. So transposition, a simple transposition is adding the power of the sphere and the cylinder and changing the power and the axis of the cylinder is the how you do a simple transposition. Question number 2. 1 diopter in refractive error is usually associated with a dash millimeter change in axial length. Option A, 0.2 millimeter change, B, 0.3, C, 0.4, and D, 0.5. Your time starts now. And the answer is 0.3 millimeter. It's a data set that we need to study by heart and keep because it is very, very important for us in refraction. Next question. Compared to adults, preterm babies have A, normal cornea, B, thinner corneas, C, thicker corneas, and D, irregular cornea. And your time starts now. And the answer is C, thicker corneas compared to adults, and becomes thinner as they grow to term. Next is question number 4. Which of the following is true regarding congenital ptosis? Option A, it is most commonly caused by a defect in Muller's muscle. B, it is associated with poor Bell's phenomenon. C, it is typically associated with Marcus-Gunn-Jaw-Winking syndrome. D, always requires surgery before the age of 1. And your time starts now. And the answer is B, it is associated with poor Bell's phenomenon that occurs because it is usually associated with the superior rectus hypoplasia, and that is why the Bell's phenomenon does not work so well when there's congenital ptosis. It is not a Muller's muscle problem, it's usually due to the LPS, and it is not typically associated with Marcus-Gunn, though you can have a Marcus-Gunn-Jaw-Winking type of congenital ptosis, and you need to do the surgery only depending on how much ptosis is there and the risk of amblyopia. The age of intervention depends on that. And we'll go on to the last question of this round, which is, which of the following is the primary reason for increased myopia progression after prolonged near work? A, central hyperopic defocus. B, peripheral hyperopic defocus. C, convergence excess. D, corneal steepening. And your time starts now. And the answer is a peripheral hyperopic defocus. This is a phenomenon that we saw very much during COVID times when there was prolonged near work for all the children and myopia had increased to unprecedented levels. And this is one of the mechanisms that is postulated for the increased myopia after prolonged near work. With that, we come to the end of my set of questions. Over to you, Dr. Shilpi and Dr. Prashant.
Thank you. Thank you, Dr. Natasha, for wonderfully taking us through this last round, I believe. Dr. Shilpi,
Yes, sir. We are through with the
we are through
quiz.
with. So now our welcome, Mr. Surya Narayanan. He is the person who is helping us out and sponsoring our this particular season. Thank you on behalf of Brain Teasers team. Mr. Sai, we need to find out who are the top three people from the private practitioner category.
Working on in a few minutes.
Okay, since till he is computing, Nilotparna could join us. Shilpi, you can come online live. Okay.
Dr. Shilpi seems to have left. I
Yeah.
think she logged out.
Okay. So I think we are through with this thing till Sai computes the whole results for us, and who are going to be the amongst the private practitioner category who could make it into the top three. Till then, we can have a small chat. So I think Natasha, it has been your third or fourth season with us.
I think third, sir.
Third season for us. So how do you experience, or do you find any change with us? How any inputs?
No, it's just as seamless as it was before.
Thank you.
Yeah, and
Thank you.
it's been going around in our groups also, in the state group, so everyone is actively participating.
Thank you. Thank you. And Praful also, I think it is a second season for him.
No, as a quiz master first season. Last time I
Ah.
was mentor to one of the team which is finale.
Ha.
But as Dr. Natasha said, Sai is doing a wonderful job. It's seamless. Normally, while conducting quiz virtually, there may be little bit here and there nags, little bit hiccups, but this was absolutely smooth. At no point there was any problem with the
Yeah.
term.
I think we should not give just credit to Sai. It's his team from Numerotech who does the job,
Yes,
and
yes.
guy just fishes of
Sai
all.
ital, permit term Sai ital.
So I think these are the people, private practitioner. Can we have them online? You have to raise your hands. The people, we have put it on the screen. So it is PP 8597993902 KM. Whoever it's it, just raise your hand on the screen so that we can invite you on the screen to log in with us on the Zoom platform. The second is 94011672009 TAN, and on number one today was 70344705552 ATH. Can we have the privilege to have you and all the in fact everyone is interested in logging, means seeing who are these people who have amongst the top three. So we have one of the participants, it's Q. So Q Mondal, where are you from?
From
Come like,
AIMS Raipur. AIMS Raipur, senior resident from AIMS Raipur.
Okay. Good. Congratulations. We are so proud to have you, Q.
Thank you.
Congratulations, Dr. Mandal.
Thank you, sir.
Congrats.
So
Thank you,
which
sir.
subject you are doing a senior residency into?
In
Or it
AIMS
has to be
Raipur, it is
rotated?
comprehensive, rotated. In
Okay.
Raipur, there are no
unit.
specialty, sir.
Okay. Ankur Shivasto and is with you. Okay.
Yes, sir.
Okay. Good. Congratulations. And virtually we can request Surya Narayan sir to hand over the prize. Surya Narayan sir, you can compliment. He's representing and he's the head of the as a CEO of the His Highness.
Congratulations, Dr. Munda.
Thank
All
you,
the best.
sir.
All the best. And congratulations to all the winners.
Thank you.
Thanks.
Your pride.
Thanks
And your,
to yes, Doctor. Yes.
No, go ahead. I'm sorry.
Thanks to you, Doctor, for giving us this opportunity to host the quiz.
Thank you.
And thanks to all the quiz masters, to Dr. Prafula and Dr. Natasha. Thanks a lot.
Okay. So Q, this is your first year of senior residency or second year?
The first year. Last time I am finalist in PG category.
Correct, correct. That's what I said. Good, good, good. We are so proud to have you now as a private practitioner category since you are not eligible as a resident. We only people who are within first 3 years doing their post graduation are eligible to play this, and the rest all have to compete in the private practitioner category. We are so keen and we are so happy to see you still having that quest for knowledge and
Continuing the
still.
passion, correct.
Hmm?
We're
So
continuing his passion for quizzing.
correct. And
Yes.
keep this drill of learning in future as well. That is absolutely great. Congratulations once more. Your check money and all will be at the conclusion of the season. We will be transferring the money. His Highness team would be coming and personally handing over the check. Hmm?
Thank you, sir.
Sai, any more others winners could log in?
Dr. Athira
Athira
Dev.
Dev.
Oh, Athira.
Hi,
Good
sir.
evening and welcome, Athira.
Hi, sir.
Congratulations, Athira.
Thank you, sir.
Congrats.
Congratulations, Doctor.
Okay, can you just tell us something about you? We are all keen to know. So also the other viewers who are participating in the quiz. Athira, what are you? Where are you from?
So I'm from Kannur, Kerala. I'm working as a pediatric ophthalmologist. And actually, I'm
Oh.
proud to tell you that I was the second runner-up in the first season of BQ. It was like,
Congratulations.
after that, I was always following it and attending all the quizzes. Now, so it's kind of like my specialty. I have to attend.
Oh, that's good. So
Questions must be easy for you. Pediatric ophthalmology. It was tough for me while making the questions.
Natasha must have. What do you say about this girl? You must
Congrats. I'm happy to see someone from Kerala here.
Oh, in fact, she was finalist with us in one of the last seasons.
Yeah.
And your partner Athira was that time
It was Gayatri,
Gayatri. Correct.
the first
So,
season. Yeah.
very good, very good. Keep
Very
up this.
Keep up the passion.
Thank you,
Keep up
sir.
this passion and keep on learning. And
Yes.
best of luck for you in the future.
Yes, sir. Thank you, sir.
Okay. And
Panchami Gupta is there.
okay, Panchami, you can log in. She's fourth, she claims to be. She's again a old,
Hello.
she's been always. Yes, Panchami, aajao.
Hello.
Hello.
Congratulations, Dr.
Hello.
Panchami.
Congrats.
Congratulations.
Am I audible?
Yes, Panchami.
Hello, sir.
Hi.
Where is
Hello,
your
ma'am.
sister, Panchami?
Yes, sir.
Where is Nikita?
So she was also giving the quiz, but I don't know. Her name is not there.
So
This,
name quiz and Panchami will be there.
yeah, Panchami and Nikita, they are the
Ma'am, she
habitual
specially
winners.
called me up that the quiz is starting, you start playing. And I was like, I'm too tired today. But she's like, no, you have to give it.
Good. So happy to see you back again in a new avatar, I should say, Panchami.
Thank you, sir.
But it's high time. I think you should give opportunity to the other people in the queue.
Sir, I
You
just
two
sir, I
sisters
just
will
give to
pocket
learn.
every money out of our quizzes.
Sir, it's okay if you don't give me the money. I just want to play.
Yeah, I'm just pulling you.
No,
I'm
no,
just
thanks.
pulling you. We're so proud to see you again. Keep up the spirit and keep up the spirit to learn more. And we would, of course, be obliged and we are very privileged to have you back again and again.
Sir, I am obliged.
Okay, thank you.
Thank you,
Thank you,
sir.
Panchami. Thank you once
Okay.
more.
Okay,
So
sir.
congratulations to all the winners for today's episode in the private practitioner categories. And postgraduates who have been playing with us, remember this was the fourth episode. We have two more episodes, preliminary rounds left. And remember, it is going to be the cumulative score of top four performances. Top four performances of the preliminary round that will help us in deciding who are going to be into the quarterfinal rounds. The best of them we are going to qualify for the quarterfinal rounds.
Next is 5th March.
And the next we are meeting on 5th of March again at 7:30 p.m. And the theme is going to be neuro-ophthalmology and oculoplasty. So till then, I think it is time for us to wind up from our end and sign off. And thank you, everyone. Thank you, Dr. Natasha. Thank you, Nilutparna and Dr. Praful.
Thank you, sir, for inviting us.
No, it is
And
our
thank you, all
privilege
the
to have you
students.
all people. we keep you nagging and we keep you getting you back again and again so that we have the best of the quiz masters for our all postgraduates across the country. Thank you once more for sparing time for our postgraduates. And of course, Suryanarayan and your team, they're doing phenomenal job. Thank you once more for being steadfastly with us. We hope to
Thanks,
meet.
thanks a lot, Doctor. It's our pleasure and privilege.
Thank you.
We're looking forward to these kind of opportunities. Thanks a lot, doctors.
Thank you. So till then, bye-bye. We are meeting again on 5th of March, 7:30 p.m. Bye-bye. Good night.
Good night. Yeah.